Every year, 18 million lives are lost to cardiovascular diseases, with at least 75% of these deaths occurring in lower income countries like Pakistan, where the burden of CVD is increasing. Most of the deaths that have occurred and are to come are preventable. Patients need repeat care, but this means frequent hospital visits, so patients lose time, wages, and their savings while only gaining stress. This model of care taken from the West does not work. But there's a better way, Sukoon. We're changing the model of care to fit the resource constraints of lower income countries. Through our software driven delivery model, we provide personalized cardiac rehab in person, on demand, and at home. So we meet the needs of patients, and patients get the repeat care they need affordably and stress free. Patients are referred to Sukoon and simply arrange home visits via text. Over 6 fortnightly sessions, an assigned nurse delivers a holistic CR program covering exercise, diet, lifestyle, and mental well being. The nurse is guided by a web app, which tailors the program to the patient's needs and monitors their progress, such that by the end of the program, patients are equipped and empowered to manage their condition independently. Almost 1 in 5 people in Pakistan develop heart disease, and with prevalence growing, the market demands a solution to ease their burden. Currently in Karachi, there are 2.2 million CVD patients seeking some form of treatment. Of those, we estimate more than 400,000 fall into our serviceable obtainable market. So if we were to reach them tomorrow, we could save at least 6,000 lives, improve their quality of life, and save them a collective £112 million in healthcare costs. Furthermore, if we were to serve the whole of Pakistan for 5 years, we would save patients £4.4 billion with a social return of £3,000 for every pound invested. And once we've established a model of care in Pakistan suited to low resource settings, we'll be well placed to apply it in other lower income countries to have a greater positive impact on global health. The impact we aim to have in Karachi alone will go a long way to achieving our guiding principle of reducing inequity in healthcare, while also contributing to UN Sustainable Development Goals 3, 8, 10, and 17. Our competitors are failing to improve the lives of CVD patients. Unlike them, we make care stress free, convenient, and accessible by delivering it at home. And thanks to our software, we're the only holistic program designed to succeed in low resource settings. We've spoken to our patients in Karachi, and it's clear patients hate traveling to the hospital. They'd much rather have home based care and would consider paying us for Sukoon's service. We've tested an initial prototype at no cost to 3 patients, receiving very positive feedback, with patients reporting improved confidence and independence. Not only do our end users love us, but so do healthcare professionals. They recognize the immense value Sukoon provides to both the patient and the healthcare system by reducing pressure on their services. And through conversations with hospital directors, we've signed 2 MOUs to conduct a 200 patient study to further establish product market fit and inform prototyping. And we have 2 more contracts in the pipeline. We plan to enter the market through partnerships with cardiologists and GPs in Karachi who will refer patients to us. These patients will be charged 1,000 Pakistani rupees per session. Then, in order to scale rapidly, we intend to partner with hospitals using a split revenue model and sell corporate healthcare packages, charging each corporation a subscription per employee per quarter. Having trained as life scientists, all 3 co founders possess the skills to drive Sukoon forward with evidence based, data driven solutions. And with our complementary backgrounds in healthcare and business, we're equipped to overcome challenges faced by health tech businesses. Janine's local extensive network within healthcare and pharmaceutical communities has created partnerships with hospitals and access to potential commercial partners. Akhilesh's experience in data analytics, pharmacovigilance, and software design guide the development of our web app and service. Hansa's entrepreneurial and research endeavors are instrumental in recruiting a strong advisory panel who bring a wealth of experience in cardiology, healthcare management, investment, law, and business. Our progress has been recognized by a number of support programs through which we've so far won £7,000 in equity free support. With the £10,000 Health Innovation Prize, we'll run a 15 patient soft launch during which we'll work with our patients to curate the end user experience, such that when we hit the market, our service will be well adapted to meet the needs of our patients and effortless to use. This will put us in a strong position to scale and become sustainable.